The state's first rural hospital since Medicaid expansion will officially close its doors tomorrow. DeQueen Medical Center has faced financial uncertainty for months, and while there are multiple factors that played into this, KRK4's Jesse Tenor joins us with why more hospitals could be close behind.
Yeah, Ashley, so in 2013, Arkansas became the first state in the country to receive approval to expand Medicaid. Since then, a West Memphis hospital closed due to a fire, but as far as financial troubles go, DeQueen could be the first of several not immune to closure. Without DeQueen Medical Center,
the community needs a hospital, or we don't have anything.
Ambulances have to transport patients at least 35 miles away for help.
We have to have a place to stabilize.
It's the first rural hospital to close its doors in Arkansas since the state became the first to expand Medicaid.
Our expansion in the state of Medicaid helped secure the viability of rural hospitals in particular for a period of time. I think we're coming to the end of that period of time.
During the last decade, nearly 40 rural hospitals in surrounding states that did not expand Medicaid closed. Now the natural state will get its first red dot, with more on the way.
There's some other complicating factors with DeQueen, but I think it is the first, of several that are going to have more financial strain on them in the coming years.
Dr. Joe Thompson, the state's former Surgeon General and the president of the Arkansas Center for Health Improvement, also anticipates an end to the critical access hospital designation, which nearly 30 hospitals across Arkansas, including DeQueen, have depended on for funding.
We need to rethink what and how we support rural hospitals and rural health care across our state.
For example, under current state licensing requirements, local communities must have a full-service acute care medical center, something Dr. Thompson says could change.
The overhead and the operating costs are making it where that's more and more difficult.
Officials say the building must remain.
DeQueen's county leadership does plan to build a new hospital from the ground up. The question, though, remains how to pay for it. Back